This training video will demonstrate how to properly perform each of the recommended exercises and identify cues to focus on when instructing your patients. We recommend patients start off by completing 3 sets of 10 to 12 repetitions for each exercise, with a goal of 30 minutes a day for 5 days a week. If patients cannot tolerate this amount of activity during the start of the program, that's okay. The overall goal is to get the patient moving as much as possible, increasing their activity slowly over time. Hip flexion. Start off with the knees bent, heels flat on the floor, shoulders rolled back, and eyes looking forward. Without rolling your knee in or out, raise your right leg into your chest, holding for 1 second and slowly lowering back down to the ground. It's important to maintain a tall, upright posture throughout the entire movement. Glute tightening. Start off in a tall, upright position, keeping the feet hip width apart. Cross the arms and contract the glute muscles. The longer the glute muscles are contracted, the more difficult the exercise will be. Knee extension. Sit towards the edge of the chair with both knees bent and feet flat on the floor. Extend the right leg out as straight as possible, focused on tightening the quadricep muscle. Hold for 1 second and slowly lower back down to the ground. Make sure to maintain a tall posture and keep the eyes forward throughout the entire movement. Abdominal crunch. Sit up tall, tuck your chin in towards your chest, cross the arms. Inhale and bring your elbows down in toward your thighs. Exhale as you come back up to the starting position. Oblique twist. Sit with both feet flat on the floor, maintaining a tall, upright posture, keeping the arms and elbows flexed. Bring the right knee towards the left elbow and slowly lower back down to the ground, alternating bringing the left knee to the right elbow. Hip abduction. Sit towards the edge of the chair, keeping the right foot flat on the floor, straighten the left leg out. Raise the left leg up and rotate out to the left side. Hold for 1 second and return to the starting position. Try only using the hip muscle by keeping the left leg parallel to the ground and toes pointed towards the ceiling throughout the movement. Toe touch. Slide towards the edge of the chair, keeping the left leg bent and left foot flat on the floor. Straighten your right leg and point the right toe up towards the ceiling. With one hand on top of the other, reach down as far as you can towards the ground. Remember, focus on keeping that right leg as straight as possible. It's important to not hold your breath throughout this movement. Be sure to breathe, reaching further with every exhale. Hold for about 20 to 30 seconds on each side. Hip lengthening. Start off sitting towards the edge of the chair with both feet flat on the floor. Rotate 90 degrees towards the left, keeping the chest up. Drop the right knee back towards the ground. Slide your right leg back while keeping your left leg bent and chest up tall. Place the left hand on your knee or the chair for support. Hold the position for 20 to 30 seconds and repeat on the other side. Figure 4 stretch. Sit up tall with both feet flat on the floor. Bring your right leg over your left knee. Gently push down on your right knee and lean forward to feel more of a stretch. Hold for 20 to 30 seconds and repeat on the opposite leg. To make the stretch a little bit easier, you can start by straightening the left leg, then crossing the right leg over and pulling up in towards your chest. Chest and bicep extension. To start the stretch, you may have to rotate in your chair so that you have enough space to straighten the arms behind you. If you can, clasp the hands behind the back, press the arms straight down into the ground, keeping your chest up. If you're unable to clasp your hands behind your back, just reach the arms back behind you, pressing your hands down in towards the chair. Shoulder extension. Start by sitting up tall, taking one arm, reaching it across your body, making it as straight as possible. Grasp the elbow with the opposite hand and gently pull in towards your chest. Tricep stretch. Start by sitting with a tall, upright posture. Reach the arm behind you so that your palm is facing the middle part of your upper back. With the opposite hand, reach across and gently push up on the elbow. To make the stretch more difficult, reach the arm behind the head and pull down on the elbow. For your more functional patients, we have provided a list of progression exercises. These progression exercises were designed to help increase the intensity of the exercise program. To determine which patients need the progression exercises, refer to the RPE scale. Look at the patient's previous exercise log. Those that consistently rated the RPE scale as less than or equal to 3 may be appropriate candidates for the progression exercise education. Standing hip flexion. Stand up tall with feet shoulder width apart, shoulders rolled back, and eyes forward. Using a chair to help maintain your balance, raise your right knee up towards your chest, not letting the knee roll in or out. Hold the knee raised for 1 second and then slowly lower back down to the ground. To make the exercise more difficult, you can slide the chair away from you. Sit to stands. Start towards the edge of the chair with feet shoulder width apart. Keeping your head up, lean forward as you rise to a standing position. Use your hands for support. Sit down slowly, keeping your eyes forward and chest upright throughout the entire movement. To make the exercise more difficult, you can cross your arms at your chest. Straight leg extension. Start towards the edge of the chair. With the left knee bent, straighten the right leg, keeping the right heel on the ground. While keeping the leg straight, raise the right foot up until it becomes parallel with the ground. Hold for 1 second and slowly lower back down. Seated reverse crunch. Start this exercise by sliding towards the edge of the chair. Support yourself by placing the hands on the side of the chair, keeping your core tight without rocking back and forth too much. Raise your knees up toward your chest. Try holding the position for 1 second before lowering back down to the ground. Standing oblique crunch. Start this exercise with feet shoulder width apart and arms flexed. Keeping the core tight, raise your left leg up while bringing the right elbow down towards the left knee. Alternate by bringing the right knee up and left knee down. Focus on keeping your head up and abs braced throughout the entire movement. Standing hip abduction. Stand up tall with feet hip width apart. Support yourself by grabbing onto a sturdy surface, keeping the chest straight and toes pointed forward. Slowly raise the leg out, hold for 1 second, then lower back down to the starting position. Focus on only using your glute and hip muscles. Remember, the goal of this intervention is to get the patient moving as much as possible. When teaching these exercises, please stress the importance of adhering to a daily exercise routine and be sure to provide encouragement whenever possible. If you have any questions about the training video or the protocol, please contact me at the email shown. Thank you again for participating in our pilot study.